Hello YouTube, Sir Dragon X here, coming to you from the beautiful city of San Miguel de Allende, Mexico. Today is part 2 of a 3-part series of healthcare in Mexico. So let's explore in the video coming up next. Welcome back to Retired Life in Mexico. No bull. Not only will we present you with the facts, but we present you with the true reality. Today is part 2 of a 3-part series on healthcare in Mexico. In this part of the series, I am going to discuss the private healthcare system and private healthcare insurance options here in Mexico. In part 1, I discussed my personal experience with the private healthcare system. In this part, I plan to go more into detail on how the private healthcare system works and discuss insurance and payment options. There are 2 types of healthcare here in Mexico, public and private. In part 3 of this series, I will be discussing the public healthcare system, but for now, I will be focusing on the private healthcare system. My wife and I use the private healthcare system here in Mexico, and we have both United States health insurance and Mexican private healthcare insurance. I will be speaking from my own personal experience, and I also have a special guest today to give you an overview of how private Mexican health insurance works. I am going to focus less on the quality of care and more on the technicalities and payment options of using the private healthcare system here in Mexico. Before we start, I want to remind you to subscribe to this channel and hit the little bell so you don't miss any of my future videos. I also encourage you to like this video if you enjoyed the content. It helps me get the word out on YouTube. Also, don't forget to visit us on Facebook, Twitter, Instagram at the links listed in the video and the banner of this channel. Healthcare here in Mexico is a hybrid of public hospitals and clinics run by the government, private hospitals and clinics, and private physicians. The private healthcare sector makes up a substantial portion of the Mexican healthcare system. Services provided by private institutions and private physicians in their offices are afforded by a part of the population either by contracting a private healthcare insurance or by paying directly for the services rendered. So basically, folks, you pay cash up front or you utilize a Mexican insurance policy. Most hospitals and doctors do take credit cards though. Now, I know, here's the million-dollar question. How did I get my U.S. insurance to pay the bill? Also, if I have U.S. medical insurance and Mexican medical insurance, why didn't I use the Mexican medical insurance? Well, truth is, at the time, I did not have a Mexican medical insurance policy. As far as my U.S. insurance paying the bill, they did pay out at 90% as they would in the United States, but there is a catch. I had to pay up front and submit my own claims and then was reimbursed. As far as pre-approvals, I didn't have to submit any documentation. I submitted the claim after services were rendered with documentation and they reimbursed me, no questions asked. It wasn't as simple as giving my insurance card, but my out-of-pocket expenses were only $2,500 when it was all said and done. Of course, the next question you're going to ask is, what insurance do I have? Do all of you insurance companies do this? How did you find out you were covered? Well, to answer the first question, I have Aetna insurance through my government retirement. As I have mentioned in previous videos, I served as a diplomat in Brazil for 3 years, and while I was there, my insurance, Blue Cross Blue Shield at the time, covered me. So I decided to give Aetna a call to find out. Turns out that my policy covers foreign claims, and they instructed me how to file the claims. Now, I can only speak for my insurance policy, and I am aware that many insurances vary widely as far as coverage, but I would advise you that if you do in fact carry U.S. insurance like I do, call and check. Ask what type of coverage they offer. Ask if they cover you if you live in a foreign country. You may be surprised. I definitely was. With that being said, Medicare does not cover you outside the United States. Now, I am aware that there are some type of limited coverages in case of an emergency in certain situations, but I am not aware of the exact requirements to be covered. But in a nutshell, for all intensive purposes, Medicare does not cover a person living in Mexico, unless of course you go back to the United States for care. As I always say in my videos, I'm not an expert, so I asked my personal licensed insurance agent here in Mexico to make a guest appearance in this video. Now, quick disclaimer, I am in no way affiliated with this insurance company, nor am I promoting this insurance company over any other here in Mexico. This is not a sponsored video. This guest that I chose to put on this video is for the express purposes of explaining how Mexican medical insurance works. I would like to introduce Ana Caballero, who is a licensed insurance representative for Seguros Monterrey, New York Life. In this clip, she is going to explain the types of private healthcare insurance and how they work here in Mexico.
Si tuviéramos que hacer una división para poder explicar los tipos de seguros de gastos médicos mayores, podríamos comenzar por diferenciar primero en cuestión de su cobertura, el territorio que cubren. Y entonces podríamos decir que hay seguros de gastos médicos de cobertura nacional y gastos médicos de cobertura internacional. Y bueno, como su nombre lo dice, los de cobertura nacional nos cubren en todas y cada una de las ciudades dentro de México como país. Los de cobertura internacional nos cubren en México y en el extranjero. Una segunda manera de dividir los tipos de gastos médicos que existen en Seguros Monterrey New York Life, podríamos basarnos en el nivel hospitalario. Estoy hablando de cuando algo me suceda, yo asegurado, ¿a qué hospital quiero acudir? Entonces, hay seguros con New York Life que nos cubren todos los hospitales en todas las ciudades del país. No tengo que preocuparme, están cubiertos todos los hospitales. Hay algunas otras opciones de planes que empiezan a sacrificarse algunos hospitales, empieza por ende a ser menor el costo anual que voy a pagar por mi seguro. Y de nuevo, tendríamos que tener una conversación, ver qué es lo que necesitan, en qué ciudad viven, qué hospitales son los que en esa ciudad van a usar, van a utilizar, y entonces podríamos determinar cuál de los diferentes planes por nivel hospitalario debería ser el más adecuado para ustedes. Y por último, podríamos también dividirlos tal vez por sus deducibles. El deducible es una cantidad en dinero de la cual va a participar siempre el asegurado a la hora de un siniestro, a la hora de una enfermedad o de un accidente. Y entonces podemos elegir diferentes deducibles, hay una gama de deducibles muy amplia que igualmente determinará la comodidad en el pago anual de mi seguro o determinará la comodidad a la hora de entrar a un hospital, con cuánto voy a participar.
Now, I'm going to have Ana explain the requirements foreigners must meet to buy a Mexican health insurance policy and how the process works.
Si hablamos de requisitos, los podemos dividir en dos: requisitos de documentación y requisitos de asegurabilidad. Los requisitos de documentación son de lo más sencillo y realmente creo que son los mismos documentos que van a estar ustedes utilizando a su llegada al país. Son los documentos que les acreditan la calidad migratoria en México. Vamos a iniciar primero con llenar una solicitud de Seguros Monterrey New York Life. A esta solicitud la deben acompañar una copia de pasaporte, una copia de mi residencia temporal o permanente vigente y una copia de un comprobante de domicilio también vigente del domicilio en el que llegué a establecerme a México. Esta es la parte de los documentos. Y una segunda parte, que son los llamados requisitos de asegurabilidad. Estos van muy de la mano de lo que vamos a platicar cuando nos veamos. Esto va muy de la mano de de cuando llenaremos la solicitud en un momento dado. Y vamos a hablar del historial de salud de cada quien. Vamos a hablar de qué enfermedades en el pasado he padecido. Vamos a hablar de qué accidentes he tenido, qué tratamiento estoy tomando. Todo esto tiene que ser plasmado en la solicitud, tiene que correr un proceso y pasar por un área llamada selección de riesgos, donde los médicos dictaminan si la persona puede o no puede ser asegurable en Seguros Monterrey New York Life.
Thank you, Ana, for that great explanation. But if I can elaborate a little bit more, most, if not all, Mexican healthcare insurance policies will not cover pre-existing medical conditions such as my head and neck cancer. Also, the cost is based on your current health condition and age, but your medical insurance representative can help you with that. Now, in this next segment, I'm going to have Ana explain the importance of contracting a reputable insurance company when purchasing insurance.
En México, el organismo encargado de calificar a las compañías aseguradoras y de regularnos es Conducef. Y Conducef en sus estadísticas habla del gran nivel de servicio, el gran nivel de satisfacción que tienen los usuarios de nuestro servicio. A la hora de la verdad es cuando conoces realmente a tu agente y a tu compañía de seguros. Tu agente está ahí acompañándote y guiándote en esa enfermedad o en ese accidente. Y tu compañía de seguros está respaldándote con un gran equipo de expertos en el tema para sacar adelante la situación que tú estés necesitando en ese momento.
That was great. I would really like to thank Ana Caballero for taking the time to explain the Mexican medical insurance process. So what did I learn while going through the process of obtaining Mexican medical coverage? Make sure you go with a reputable insurance company. Many are backed by major well-known international companies. This is why we went with the company backed by New York Life. Next, when meeting with an insurance agent, ask for their Conducef ratings. This is a government agency that regulates private insurance. If they don't want to provide you with these ratings or are not connected with Conducef, you may want to reconsider. Sit with your licensed agent and explain your needs. Our agent worked with me to get us covered even after I had my cancer. You can reduce the cost of premiums by sacrificing levels of hospital care or increasing your deductibles, but be aware of what you're sacrificing. For example, we travel a lot, so we are covered throughout Mexico at any hospital. Some policies are limited by region, for example, and in our case, that wouldn't be an option. If you travel back to your home country a lot, you may want to consider a policy with international coverage. Now, I have seen many offers for global or expat insurances. Make sure that these are in fact Mexican insurance policies regulated by Conducef and ask questions such as which hospitals are covered. Ask how they pay their claims. You may end up paying out of pocket and getting reimbursed later or find out hospital coverage is limited. Payment up front or insurance is required before obtaining medical care at any private institution. Some of these companies claim to be able to make arrangements with the hospital, but that is not the case in all hospitals. Guadalajara is very well known for working with foreign or third-party insurance, but even then, not all hospitals will work with these insurances. I hope this was informative, and if you have any other further suggestion or want to share your experience with different Mexican healthcare insurance companies, feel free to leave a comment in the comment section below. My next video will be on public healthcare, so stay tuned and don't forget to subscribe so you won't miss out. Until next time, see you soon.